नमस्कार, मेरा नाम डॉक्टर जोशिता पंडिता है। मैं यहाँ फोर्टिस हॉस्पिटल में डिप्टी मैनेजर हूँ मेडिकल सर्विसेज में। आज हम यहाँ मिले हैं टू स्पीक अपॉन लिवर कैंसर एंड उसकी मिथ्स के बारे में। सो आई वेलकम हियर डॉक्टर गौरव गुप्ता। वेलकम सर हियर। ही इज़ आवर कंसल्टेंट इन liver transplant surgery and hepatobiliary surgery. So Dr. Gupta, we have come across a lot of myths related to liver cancer. So I would request you to answer some of them for us. सो आजकल बहुत ये मिथ है कि लिवर कैंसर जो है अल्कोहल और स्मोकिंग की वजह से ही होता है। सो आप क्या इस पे कहना चाहेंगे?
So thank you, Dr. Joshita, for having me. So it's a very interesting and important topic, liver cancer. The reason I'm saying is कि जो liver cancer का incidence है वो it has increased a lot in last many years, last 10-20 years. नाउ जैसे आपने बोला एक जैसे कॉमन मिथ कि लीवर प्रॉब्लम सिर्फ और सिर्फ अल्कोहल से होती है। मेरे पास कितने सारे पेशेंट आते हैं जिनको बोलते हैं कि सर हमने तो लाइफ में कभी अल्कोहल पिया नहीं, फिर भी हमारा लीवर ख़राब हो गया है, फिर भी हमारा लीवर में कैंसर हो गया है। सो दैट इज़ ए वेरी कॉमन मिथ, ऐसा कुछ नहीं है। सो लीवर कैंसर किसी भी सिरोटिक पेशेंट को हो सकता है। सो सिरोसिस का कॉज कुछ भी हो सकता है। तो सिरोसिस कैन बी बिकॉज ऑफ अल्कोहल, सिरोसिस कैन बी बिकॉज ऑफ hepatitis B, cirrhosis can be because of hepatitis C, non-alcohol steatohepatitis, which is called NASH, which is a very common cause of cirrhosis. So any cirrhotic patient can develop liver cancer. So this will be totally wrong to assume कि खाली अल्कोहल और स्मोकिंग से ही हमारे को लिवर कैंसर होता है।
As we are speaking on liver cancer, so then is another question. Liver cancer is only diagnosed in the later stage, sir?
Correct. So that is another a very good question. The reason I'm saying कि yes, that is a sometimes it's a problem. कि the reason being कि liver is a organ जिसका so it's a big organ. So generally जब तक इसका अगर कोई लिवर में कोई गांठ है या ट्यूमर है, जब तक उसका साइज बढ़ता नहीं है तब तक जनरली तक वी डोंट गेट सिम्टम्स। बट द गुड थिंग इज इफ वी डू अवर रूटीन चेकअप like a yearly health checkup, which is very mandatory these days, considering we have so many of health lifestyle diseases. So if we do a regular checkup, which includes simple things like simple liver function test, blood test, along with the sonography of the abdomen, so these things can help us in diagnosing a liver cancer at the early stage. सेकेंडली जो मैं बोलना चाहूँगा, जो मैसेज देना चाहूँगा फॉर ऑल आवर लिसनर्स कि सो ऑल द पेशेंट्स जिनको लिवर सिरोसिस डायग्नोज हुआ है, सो दीज आर द पेशेंट विच इज ससेप्टेबल टू गेट लिवर कैंसर. सो ऑल्दो आपको सिरोसिस है बट सिरोसिस से रिलेटेड आपको कोई भी सिम्टम्स नहीं है, still it is very important to get yourself checked up every 3 monthly or 6 monthly for liver cancers, because cirrhotic patient can develop a liver cancer.
So do these patients who have liver cancer, do they develop a lot of pain in their life?
So liver cancer, the basically the good thing will be to tell what are the signs and symptoms of the liver cancer. So
Right.
one the thing is you asked. So liver cancer ऐसा है कि the most common liver cancer is hepatocellular cancer, जो कि मैंने बोला कि cirrhotic patient में होते हैं. There can be other types of liver cancers जिसको हम cholangiocarcinoma बोलते हैं, hepatoma बोलते हैं. So these are the other, but these are not that common. Generally liver cancer का there is no sign and symptoms, so they can present as a completely asymptomatic mass. जो साइंस एंड सिम्टम्स होते हैं वो सिरोसिस की वजह से हो सकते हैं. सिरोसिस की वजह से जॉन्डिस हो सकता है, सिरोसिस की वजह से पेट में पानी भर सकता है, पैरों में सूजन आ सकती है, किडनी इंजरी हो सकती है, हेपेटिक एन्सेफेलोपैथी. सो दीज आर द साइंस एंड सिम्टम्स ऑफ सिरोसिस. एज सच लिवर कैंसर का देयर इज नो फिक्स साइन एंड सिम्टम. लेटर स्टेज में जो एडवांस केस हो जाता है, जब लिवर की ग्रोथ, कैंसर की ग्रोथ बहुत ज़्यादा हो जाती है, तो पेशेंट कैन प्रेजेंट विद लॉट ऑफ pain and cachexia and other problems of the cancers. But in an initial stage it is asymptomatic.
So as we are talking about the asymptoms and the symptoms here, so is it advisable that we should go for the liver function test every 3 monthly?
Correct. So the very important. So I will distinguish it in between two patient population. First, जिनको liver की कोई problem नहीं है. So anyone who has a healthy liver. So such individuals, I should not say patients, such individuals should get their liver checkup every year. So they don't need every 3 months. Every year they should get at least a blood test, a sonography. The incidence of fatty liver is so common these days. Every second, third individual which comes to the health checkup has a fatty liver. Now this fatty liver is the beginning of a of something very bad or sinister later in the life. So if we stop it at the right stage, so our progression to NASH, progression to cirrhosis can be stopped. So it is very important to get a yearly health checkup. Now second population which I am saying is the liver cirrhosis patients. So cirrhosis patients, they should get their blood work done every 3 months at least, which includes liver function test along with the certain tumor markers like alpha fetoproteins and with the ultrasonography or a cross sectional imaging such as CT scan or
MRI. Sir, there is again a myth कि हमारे पास liver cancer के लिए कोई treatment नहीं है.
Yes. So you very good question, Dr. Joshita. So liver cancer का treatment has progressed a lot in last 20-30 years.
Right.
From a time being where we had hardly any treatment for the liver cancer. Now broadly, if you ask me, liver cancer, if it is diagnosed at the right stage, it is very well curable, and the treatment option can be multiple. Broadly, I would describe it to 3 parts. First is the surgery, liver surgery, where we cut the portion of the liver out with the tumor. That is the liver resection surgery. Second thing, what we call is the loco-regional therapy. So loco-regional therapy includes broadly 2 things. One is called radio frequency ablation, and another is TACE, which is trans-arterial chemoembolization. Both these are minimal invasive therapies, and this function only if the size of the tumor is small.
Right.
The third very important treatment option is liver transplant. So transplant is a option for a lot of patients whose liver tumor is in the not progressed to a big size. If it's fixed, if the patient has fit into a certain criteria, then the liver transplant can actually cure it. So we have a very good treatment options available, right, starting from resections to transplants to even chemotherapy, even radiotherapy. So there is a wide range of treatment options available. So even if you have been diagnosed with liver cancer, I would just give this message that you should not lose your heart. We have a very good treatment options available for all kinds of the liver tumor patients.
Right. So as we talked about transplant, so how frequently a patient can get a transplant done in a liver transplant?
Correct. So actually liver cancer is the only tumor where transplant is advisable.
Right.
So if you have a tumor from in another part of the body, we cannot transplant those patients. What we looked into is broadly there are 2 criteria which we look before we advise a patient for a transplant. First, the tumor should be limited to the liver. It should not have gone out of the liver to other parts of the body. Second thing is tumor should not have invaded or involved directly any major blood vessel. So if it has involved any major blood vessel, then we cannot transplant these patients. But if these 2 criteria satisfy, again there is a criteria for the size of the liver tumor again. I would not go into too much detail. But if these 2 criteria fit, and there is no major liver spread to the other parts of the body, so such patients can be, I would say, even cured from the cancer by the liver transplant. And so we have patients who are absolutely asymptomatic, just diagnosed a liver cancer on a routine follow-up, and the tumor was almost 6-7 centimeters with a cirrhotic patient. In the past, such tumor there was no treatment option available, but with the liver transplant, we can take out the whole liver along with the tumor and put a new liver in, and these patients will be cancer free for a long period of time, even up to 5 years, 10 years, they will be tumor free.
So sir, coming to the end of the topic, so आप कुछ message देना चाहते हैं patients को regarding the liver health or anything?
Yes. So the message I want to give to everyone is कि liver is a workaholic organ, and it is a factory of our body, and we should not ignore our health of the liver. actually if you look into the even the media, so heart ke upar, lungs ke upar, there is a lot of awareness,
Right.
but somehow the liver health it kind of
Ignored.
gets ignored. And the reason is because liver is such an organ ki even if you kind of, I should not use this word, but even if you abuse this organ, it is kind of still works for your health. And even if the liver is damaged 60%, 70%, still you would not have much symptoms. So that's why it's kind of liver health gets ignored. So you don't have to do anything major to take care of liver health. Simple things like eating healthy food, avoiding too much fried food and high carbohydrate rich food, green leafy vegetables, you having a good lot of exercise, avoiding things like too much alcohol, taking care of your preventable disease by taking vaccines from hepatitis A and hepatitis B. Simple things. If you take care of these things, regular health checkup, blood checkup, sonography, these things, you take care of your liver, the liver will work for you. It's an organ which can, which will be actually helps in protection of the other organs also.
Right.
It gives you a lot of immunity also,
Right.
especially in the times of these COVID times.
Right.
So the immunity becomes much more important. So you just take care of your liver. A healthy liver will take care of a healthy body.
Thank you
that's
so
the
much,
only
sir.
message I want to give.
Thank you so much, sir. Thank you for your time. Thank you so much.
Thank you.